Hi, my name is Dr. Jason Bachavich, and I'm a Lyme literate naturopathic doctor based out of Canada. And I'm going to do a series of videos here that explains the different types of infections you can get through tick bites, as well as some other insects as well. Then we're going to talk about the different testing that can be done in the second video. And third video, we're going to talk about how to interpret those tests, just to give you a little bit more background on how to manage this whole thing. So for the shortness, or for the sake of being short, I'm going to be a little bit more brief and concise. So if it doesn't feel like completely comprehensive, I hope you understand, because there are over 80 symptoms associated with Lyme disease, and there's almost an 80 to 90% overlap of that with mold toxicity, right? So a lot of these symptoms are what we would consider to be kind of nondescript or not specific. So when we're talking about Lyme disease in particular, you see a lot of physical symptoms. So you will see things like sore joints, right? Migrating pains. You will see achy muscles. You will see fatigue, skin rashes, potentially fevers for periods of time. There are cardiovascular symptoms. So this could be things like arrhythmias or racing hearts. You could also have symptoms like hypertension or hypotension, right? So if you go through the body systems, there's almost no body system that is not affected by Lyme disease in effect. So when you're dealing with these kind of clinical symptoms, it's best to rule out Lyme disease. The second one that we see a lot in clinical practice, and depending on which country you're in, is Bartonella. Now, Bartonella can be transmitted through tick bites, but it is also known as cat scratch disease. It can also be transmitted through flea and sandfly bites, so you can get this off the beach. But usually it's because they bit an infected animal, and then it gets transmitted to you. So it's just a slightly different kind of way that you could get that disease. So, but what's interesting about that one is you can get it through a lot of kind of weird ways where you're not going to get that kind of bullseye rash like we see with Lyme disease. Now, to back up on that topic a little bit, the bullseye rash only happens in 10 to 20% of people, depending on which little survey that you look at. And so the bullseye is more likely to not have been there. And so if you don't have that, then it doesn't mean you don't have Lyme disease. And so now going back to the Bartonella. With Bartonella, we see a lot more neurological symptoms. So we'll see a lot of like weird sensations, like water dripping down your leg or like something crawling on your arm. We'll also see a lot of muscle twitching or eye twitching or cheek twitching or a lot of brain symptoms. So Lyme disease has the brain fog, right? It has a lot of the like mental fatigue. Whereas with Bartonella, we see a lot more kind of mental irritation. So it can exacerbate kind of seizures, it can exacerbate ADHD type tendencies, it can exacerbate kind of OCD tendencies. We see a lot of that. It's not to say that you can't have brain fog with Bartonella as well, because everyone's quite unique and different, but more often it's more brain irritation. Lyme disease can have that too. So if you suspect Lyme, you're going to want to test for Bartonella. Now, the other thing that you want to have a look at is ehrlichiosis or anaplasma, which is kind of the same organism. Now, for those ones, you're looking at clinical pictures, a little bit more muscle aches and pains. There is some joint stuff as well, but it tends to be a lot more musculoskeletal. Like you can get fevers, you can get kind of weird immune system things happening, but it tends to be a lot more kind of physical symptoms with joints and muscles. So it's always good to tack that one on if you are having those symptoms, because you never know, it might be one of those things. And in the area where I practice, there's ehrlichiosis and anaplasma is found in 65% of ticks that also contain Lyme disease. So the fact is that if you get Lyme disease from that bug, you're 65% as likely to also get anaplasma or ehrlichia with the same bite. And so when all these different infections have similar kind of clinical presentations, it's hard to know what's causing what. Now, one of the other things that we want to think about in terms of kind of the main offenders is babesia or babesiosis. There are multiple strains of these things. It's a harder thing to kind of test for depending on what country you're in. So this is why Armin Labs is a good test for babesia. Now, the main clinical symptoms that you will see with babesia is you'll see kind of a air hunger. That's a classic symptom. where people feel like they're breathing but they can't get enough oxygen. The other thing you'll often see with babesia is temperature control regulation issues. So really, really cold going really, really hot, and vice versa, like really having a hard time regulating your temperature. You can also have a lot of what they call kind of aplastic kind of crises. So you'll see rapid drops in red blood cells and potentially even white blood cells. And so if you have those kind of symptoms, pictures going on, then it would be a good idea to also test for babesia. Now, when we're talking about something like chlamydia pneumonia and mycoplasma pneumonia, this is kind of like walking pneumonia. And chlamydia pneumonia is not the STD pneumonia. It is a upper respiratory tract infection that behaves very similar, as similar bacteria as Lyme disease, where it can burrow into your tissues and get into the deeper kind of places. And chlamydia pneumonia does have a correlation with MS, for example, but it has a lot of the same symptoms that you would see with Lyme disease. It can have brain symptoms, neurological symptoms, physical symptoms, throat symptoms, like for example with thyroid disorders. Mycoplasma pneumonia, on the other hand, is what they call walking pneumonia, which basically is like you are fatigued, but you're not fatigued to the point where you can't function in life. So it's like you're dragging your heels through mud when you're walking, but you're still walking. And so the symptoms are, almost enough to take you down, but not completely strong enough. Those are the main kind of ones that I would look at for those. There are other symptoms that you can see, and you'll be able to download a checklist or a symptom checklist from the website, so that you can check like which ones you may be affected by. Now, one of the other things you may want to consider is that quite often in these bacterial infections, we will see a reawakening of these kind of latent herpes viruses. So when you're born, you're often exposed to a lot of viruses as a young child. And these could include things like Coxsackie virus, which is hand, foot, and mouth disease, Epstein-Barr virus, which is kind of, well, it's called mono, but it's also commonly known as kissing disease. A lot of teenagers get this. There's other ones like herpes simplex 1 and 2, which is kind of your kind of cold sores and then your genital herpes. There's also varicella zoster, which is your chickenpox virus. Now, a lot of people think they get it, they get over it kind of goes away. But just like people that get cold sores all the time, or shingles, for example, that's a kind of awakening of that virus that's been hiding in your body. So we'll often see a lot of that with people that have a bacterial infection, and sometimes not with bacterial infection. So if somebody comes into my office and says, I've got a thyroid disorder, and it's not controlled very well, or I have unexplained fatigue, of course we're going to test for Lyme. Of course we're going to test for mycoplasma. Of course we're going to test for some of those other ones we talked about. But I'm also going to do Epstein-Barr virus. So that's one of the things we want to look at. Cytomegalovirus typically has a little bit more association with, again, neurological inflammation. So you'll see that with migraines, you'll see that with seizures, you'll see that with a lot of kind of neurological brain and nervous system and spinal cord issues. And it's usually more kind of inflammatory, which means there's usually more pain versus more fatigue, if that makes sense. So if those are your symptoms that you're seeing, make sure you also consider something like cytomegalovirus. Now, Coxsackie virus has a very similar kind of clinical presentation if you were to take Epstein-Barr virus and cytomegalovirus together, which means that if you have some of that neuroinflammatory stuff going on, plus you have a lot of fatigue, you want to tack on the Coxsackie. Now, I'm oversimplifying it here, but otherwise we'd have an hour-and-a-half video about what you should be looking at. There are a few other herpes viruses that would be on the test requisitions sheet, and that's one of those things that you could always reach out to the lab provider to ask if that's something you should consider. But typically those are the big offenders that we would test first. And then if those come back negative and we still suspect infection, then we can send off another test kit looking for these kind of super rare bugs. Because, there are, for example, strains of Lyme that cause encephalitis that wouldn't trigger a typical test. And so, or it's called tick-borne relapsing fever, for example. You can test specifically for that. So if you are having kind of this fever that's coming and going and coming and going, and a lot of brain and neurological symptoms, and sometimes heart symptoms too, then you would also potentially test for that, which is kind of a unique Lyme bug in a lot of ways. It's hard to explain it without getting too detailed. So something else to kind of consider. Now, I guess that should pretty much sum up most of the infections that you'd be looking at. We can talk about some of the other tests that are available on that thing, but for the most part, that's this summary of kind of the symptoms of the infections. And so tune into the second video, and that's where we'll get into, okay, so which tests do I actually check off, and which ones do I order to rule in or rule out these infections?